The senior advisor to Ontario's 2003 inquiry into the SARS epidemic says Ottawa's response to the COVID-19 pandemic has been a disaster. Mario Pisami told the Commons Health Committee that Ottawa's response to the COVID-19 pandemic was slow, it was inadequate, and it failed to protect healthcare workers.
That the system to protect Canadian health workers in a public health emergency is broken and must be fixed urgently before the expected second pandemic wave.
As a result, he said, of all the infections in Canada of COVID-19, 19% are healthcare workers. That's 3 times worse than the global average and 4 times worse than what happened in China. Why did this happen? Pisami said there were 3 main reasons. 1, there wasn't enough protective equipment, particularly what are called N95 masks, which are more protective than surgical masks. Number 2, the Chief Public Health Officer of Canada, Dr. Theresa Tam, failed in her legal duty to inform Parliament and the Canadian people that we weren't ready for the pandemic. And 3, because healthcare workers were infected at a high rate, the general population was infected at a higher rate than it had to be. Pisami said he wrote to Health Minister Patty Hesley on January 31st. That is 5 or 6 days after the first diagnosed case of COVID-19 in Canada. And he told her, you're not ready, you need better protection for healthcare workers, and you particularly need to mandate these N95 masks. He never got a response. As a result, he says, there was much more suffering than there had to be. Finally, he says, this has to be fixed for the second wave of COVID-19, which is inevitable. I'm Rory Goldstein of the Toronto Sun. We're always interested in your views, and please follow us on Facebook and our YouTube channel.